Have you ever been part of a trust fall? You know, the team building activity where someone closes their eyes and willingly falls backwards, hoping the rest of the group will catch them before they hit the ground. If the group does catch them, then poof, trust, cooperation, and stronger communication appear. If only building trust were that simple, right? What if the only way for you to get food, a warm place to sleep, medical care, or other assistance was to close your eyes and fall backwards, hoping people you don't know would catch you? Worse yet, what if you did know or knew of them and they had let you fall many times in the past? What would you do? What should they do as they are waiting to catch you again this time? Welcome to Collabolutions, a health equity podcast. I'm your host, Dr. Brad Van Eden Moorfield, a professor and senior diversity, equity, and inclusion fellow in the College for Community Health at Montclair State University. In each episode, an interdisciplinary group of guests from local community organizations and across the College for Community Health team up to explore why some people experience challenges to their health and well-being more than others. We collaborate on creative solutions that bring us closer to making sure all people, families, and communities have access to opportunities to be as healthy as possible. Come join us on a journey for health equity and justice. When was the last time you asked for help for something you considered to be a bigger ask? What was it like to admit to yourself that you needed help and to just think about having to ask for it? We all need help at some point in our lives. It might be with something fairly typical, such as learning to tie our shoelaces or moving something that is heavy. For others, it might be a bit more challenging, like navigating a new country and language as a recent immigrant, or the loss of a loved one or beloved family pet. Unfortunately, too many people need help accessing the most basic of needs: enough clean water and nutritious food, a warm and safe place to stay, clothes to wear, affordable and affirmative health care, including mental health care. In the United States, 17 million households, some 44.2 million people, let me say that again, 44.2 million people experienced food insecurity in 2022. Over 37 million households experienced some type of housing insecurity, and on a single night in January, there were approximately 582,500 individuals that were homeless, with 60% staying in either an emergency shelter, a safe haven, or a transitional housing arrangement, and 40% completely unsheltered. If you needed food for yourself or a child, a warm and safe place to stay, medicine for an illness, and or clothes to wear, what would it take for you to be able to ask for help? How would thinking about and actually asking for help differ if it were from a family member, a friend, a stranger, or a local community organization? What about if those people, organizations, or related systems that you needed to ask for help also had treated you poorly, discriminated against you, or otherwise harmed you in some way before? Think about that for a minute. Most people have a strong desire to help others, both they know and those they don't know. However, asking for help is much more difficult and complicated, including the ways I just mentioned. I decided to do a little bit of digging through our library's research databases to understand why. It turns out there are numerous research studies that find many people will not ask for help because, one, they think others will simply say no. Two, they have difficulty expressing vulnerability. Three, they fear being judged and stigmatized. And four, the person or organization they need to ask for help has a history of treating them or others like them badly in ways that can be discriminatory. Think implicit bias, systemic racism, and the many other isms out there. The latter is strongly connected to the presence of health disparities, or the differences in health outcomes and their determinants. For example, those that are African American or Black, or Hispanic, Latino, Latina, Latinx, are way more likely to experience food and housing insecurity because the systems are stacked against anyone that does not fit the typical American mold. That is, those that are white, able-bodied, cisgender, heterosexual, male, etc. We have decades and decades, like a lot of decades, of studies that demonstrate this time and time again. Addressing health disparities by engaging efforts to improve health equity typically focuses on promoting fair opportunities, reducing systemic barriers, and ensuring that everyone has the resources and conditions necessary for their optimal health. In my digging around the library and thinking about my own experiences as a person, as well as someone who previously worked in the mental health field, what I thought I knew was pretty much confirmed. Trust is a really important part of someone asking for and receiving help. In fact, the Substance Abuse and Mental Health Administration has an entire webpage devoted just to how to ask for help, an entire webpage. And what do you think is in the very first sentence on that webpage? Talk about it with someone you trust. So once again, trust. Trust occurs interpersonally between people and institutionally between an organization, the community it serves, and the people in that community. Building and maintaining trust is not universal, though. Attending to diversity and inclusion is essential, as is looking inward to examine our own potential biases. I can't imagine a more useful place to start a new podcast dedicated to health equity than developing solutions for building trust with diverse people, families, and communities. So here we are. This is the first episode of Collabolutions, and we are recording this in front of a live audience. Woo! Let's go. Yeah, awesome. So I couldn't be more excited about this amazing group of people joining me as guests and our incredible community partner, Oasis, a haven for women and children, at the center of this episode. From Oasis, we have the Director of Community Outreach, Jim Walsh. Jim is a licensed social worker and also has degrees in sociology and elementary education. He has worked at Oasis for about 22 years and also is the director of Carl's Kids Camp and has mentored countless of interns from across several of our programs and others. Jim initially developed Oasis's social service department and the Rise and Shine Saturday program. We also have Evelyn Cachuti, the social services manager, and Evelyn has been with Oasis for over 20 years, both as a volunteer and employee holding various positions such as adult education coordinator and the fund development associate. We have three guests from the College for Community Health. The first is Dr. Maninder Kaur Ahluwalia, who has a degree in counseling psychology and is a professor in the Department of Counseling. Maninder is an expert in multicultural counseling, anti-racism, social justice, and discrimination. Next is Hanan Atiyat. Hanan is the Director of Academic Advising in the Student Success Center and has been part of the Montclair State community for 7 years. Prior to her role at Montclair, Hanan was an international baccalaureate educator in the Middle East North African region and volunteered with the International Rescue Committee in response to the Syrian humanitarian crisis. Third, we have Dr. Pauline Garcia-Reed, who has been a professor of family science and human development for over 19 years and is the co-director of Project COPE, Communities Organizing for Prevention and Empowerment. Project COPE focuses on implementing and evaluating prevention efforts in Paterson, New Jersey, to reduce rates of youth HIV infection and substance abuse while also promoting ways to create healthy relationships. So I'm absolutely blown away by the people sitting on this panel with me today and their wealth of experience. There's close to 100 years of experience sitting here. For our listeners, I think it's a good place to start to provide you a little bit of information about Oasis and the community it is part of, Paterson, New Jersey. Evelyn, would you like to share a little bit about Paterson and Oasis?
Sure. Paterson is an urban city of about 157,000 people, and it's one of the poorest cities in the state. About 25 of the residents live below the poverty line, and 18% of them live less than $15,000 a year. 40% of those households include single women and children. 1 in 3 children live in poverty. Most of Paterson's residents are African American, Latino, or recent immigrants to the United States. More than a quarter of the city's residents do not hold a high school diploma. Oasis was founded over 25 years ago by 2 women who noticed that the soup kitchens in Paterson only served adults without children. And where were the children to go while the parent was inside? They were outside in a very dangerous environment. So these 2 women wanted to create a place where women and children could be safe and welcomed. We initially opened it in a church on Market Street in Paterson, and we did basic skills of ESL, GED, and at that time, childcare. Oasis has grown a lot over the past 26 years, and we've expanded our programs. We've built a new building, and now we have citizenship classes, GED in both Spanish and in English, and we have a virtual GED program in the evening. We have ESL, we have computers, and we have Surf Save programs for our students. Oasis's mission is to change the lives of women and children by breaking the cycle of poverty through these programs. We designed to feed, clothe, educate, and empower each of these women and their children. Women come to Oasis every day and ask for help, and that's where the trust also comes in. Oasis provides a variety of programs to all of our residents who come into the building, our students: adult education, youth development, basic needs, and social services. We employ over 60 employees full-time and 88 to 100 part-time employees. Over the years, Oasis will serve over 1,000 women in educational classes. We serve over 300 women just in ESL, so they can teach their children and work with their children in the schools. We have an after-school program that has 130 students. We serve a hot meal for breakfast and for lunch, which is free. We distribute diapers and food bags once a month. And over 500 women receive social service assessments each year.
So I have to say that when I went to Oasis a couple of months ago now to visit and to see what it was all about, I was absolutely blown away. Like, I mean, just really, really blown away, but by how much they do. But even more than that, just the people there. And before I went, I had heard from a lot of other students that did interns there. I had certainly interacted with Jim many times, heard other faculty and staff talk about Oasis. You have to go see. It's really this amazing place, the whole vibe there. And so I knew, but I never knew, right? It's kind of one of those situations. And when I was there, you can just feel it. Like that entire atmosphere just hits you right on the inside. You feel the trust, you feel the comfort. You see the smiles and the warmth with everyone walking around ready to greet you, to welcome you. And the diversity of the staff there, those coming for services or for a little help, was really also quite visible in a lot of different ways. From our conversations there, the trust just came out. Like that really came out as super strong. So I said, that's the inspiration for developing the first episode of this podcast. So I say we jump in and get into that. So I think I want to start first by asking, what is trust? And what are the top 1 or 2 reasons you believe help us to understand why many organizations struggle with building and maintaining trust with diverse people? So in other words, because I know that was a bit wordy, right? So in other words, what is trust and why is it so hard to build it?
I'll say in the Student Success Center, we really strive to gain the confidence of our students. And we use, appreciative approaches to really gain their trust and their confidence in us and in the service that we're going to provide. We recognize that there are, challenges and students need help to overcome the intimidation and the sort of fear to ask for help and to say, I need assistance, whether that's reaching out to a faculty or a staff member, or even just setting foot in a very formal administrative office. And because we recognize that there is that sort of fear and intimidation, again, as you mentioned, we're very mindful about making a good first impression. And so we want students to ultimately feel like the Student Success Center is a welcoming and accepting place, regardless of whatever challenges and baggages may come along with that. And that ultimately really shows to students by the way we show up for them. And we're mindful about, checking our tone when we speak to them, the way we carry ourselves and our body language. And, these students are young adults just like us. And if they can sense that we're not genuine with our, effort or approach to help, they will retreat and they will not feel like they can build the trust and have confidence in us to help them. If I can think of a particular example, we have a couple of advisors in the Student Success Center that are very specific about how they like to start their meetings with students. And when a student comes in, whether that be for an academic advising session that's by schedule or just by dropping in, the front desk will call them and say, so-and-so is here to see you. And we have folks who are mindful to come out of their office to greet the student that's in the waiting area and to greet them by name, and then to walk them back to the office for the actual meeting. And while they're doing that, you could almost hear the side conversations. How was your weekend? How are things going? And what essentially I felt that they've been doing is breaking the ice, right? Trying to build that confidence and trust and saying, this person is relatable. It's not so intimidating. And so you've already set the tone for when you're going into the actual formal setting of being behind a desk or on the other end. So that goes a long way, and we chuckle. Sometimes students come to see us for things that they know we don't offer, but we're like a stepping stone for getting them the service or the advocacy that they need.
Who else has ideas about what trust is and what makes it so hard to build and maintain it?
I think for Oasis, everybody walks through our doors is asking for help, and that's the first step. Nobody likes to ask for help, and the people who walk through have either been denied, as you mentioned, or they're afraid to ask for help, or they think that someone's going to say no because of the way the system works, right? So, like when I get called down, I'll talk to the person who's there. I'll introduce myself. How can I help you? And try to give them what they need, like if they need Pampers or a food bag. Any other services, I don't say no, because I don't feel it's comfortable to say no to somebody who's asking for help. I always say, we could, let me just do some research and see what I could do for you. Maybe I have to make a phone call to a friend of mine and make the connection. I always, when I have interns, I always ask them to when we do fairs and that, to get the business card and go visit the other organizations, because you want to have your own personal contact, right? And you want to be able to send somebody to that organization where that person is going to be treated with dignity and respect. So I think the trust build is an ongoing situation, but it starts from the beginning as soon as they come through the door.
I was just reflecting as you all were speaking about, my early days. I'm also a clinician. I'm a licensed clinical social worker. And I remember when I was newly minted MSW, I was tasked to run a crisis center. And I remember a woman coming in with a young daughter. She must have been about 13 years old. And the woman says to me, this girl's family is very chaotic and I don't know how to help her. So maybe there's something you can do. And the little girl was just sitting and kind of quietly listening as I was trying to engage this woman to try to get more information about the situation. And, they left. I put together some kind of plan so that they could come back and we could continue to work on just identifying resources that might best help this family. The next day, I get a call from the front desk that says that the little girl by herself wanted to come see me. And I was surprised that she would come without her neighbor friend. And she says to me, you know, that actually was my mother. And she's been turned down so many times that she didn't feel safe to say who she really was because she was in a really hard place in her life. And she also admitted that her mom was not really at a place where she could take care of her. So I struggled with that. I was 23 years old. People coming to see me were twice my age. I was trying to figure out what to best do. And I really believed that there was more that could be done, even though the system doesn't always say that there's more that could be done. So we ended up having to go to family court, where she was remanded to the youth shelter on Christmas Eve. And I remember her turning to me, and she looks at me and she says, "Can't you be my mom?" And it was the most heartbreaking experience for me because I knew that that wouldn't be possible. But I needed to figure out how to continue to build trust with this young person who really saw, for the first time in a long time, perhaps a system, an agency that could provide her perhaps with some kind of connection, safety net. And so she did end up staying there. And ironically, the person who I was dating at the time, who I ended up marrying, spent Christmas Eve and Christmas Day with me at that agency with her in the youth shelter. And we just hung out and we just talked and we just spent time together and we came up with a plan. And we worked with her mom. We got back into the community. We worked with her mom and we tried to identify services and support and things that probably extended beyond my role. But I was young and naive and I felt that I needed to do more than what the agency was telling me I could do at the time. But it was sort of like a wake-up call to me to say, you know, I need to be honest. I need to be authentic about what I can do, but at the very least, to build trust, because that's the gateway to everything else being possible. And even if nothing more could be done than what I'm told could be done, at least she has had a positive experience with recognizing that maybe there's more people out there that I can trust and continue to reach out in ways that maybe are beyond what I could see at that moment.
So I think a couple of things that are resonating from what the three of you have shared so far is, one, this idea of authenticity. We have to be there and be who we are in that moment, be our real self so that everyone else can feel a level of comfort. And part of that, I think many of us go into this field because we want to help. It's a true compassion that we have, and people respond to that, but it's also needed in some of the most difficult, challenging moments of a person's life, when they come in and actually find something in themselves that allows them to say, please help, or I need help, however they need to do that. But so often, kind of like we started with these 4 reasons at the beginning, people fear being told no and fear being stigmatized, and there could be shame attached for many people, but the system is just set up to be less than friendly, less than helpful, even though the people often are part of that system really do want to help. So when we're thinking about trust and also inclusion and diversity, is trust something that differs across identities or cultures or people's experiences? Or is it kind of more universal? Is trust just trust? That's a hard question, right?
So I think trust is both. There's a universality in that trust sort of means like, I got your back. But what that means, I think culturally can differ. In part, not because so much the people are different, but because people's experiences in the world are very different. People's experience in systems, with other people, with people in power, and even people in their own communities. So I think many times trust really requires a deep understanding of communities that you're serving and individual experiences within those communities. And so part of my job has been in my department and in my program is we train counselors. And so when we train counselors, we try to tell them you should learn deeply about the cultures of the communities that you serve. But a lot of our training doesn't allow for, full, deep learning about everybody, right? And we'd be doing that for years. And so I remember working with one student on research on the Sikh community. And when she went out, she's a white Christian female. And when she went out to work in schools as a school counselor, she came back and told me, that research was really helpful because I work with a young, sick youth. And he was so excited when I told him I had been to his Gurdwara. And it was like his face lit up, his demeanor changed, and then he felt like he could trust the school counselor in a totally different way, in a much more meaningful way. And so I feel like that's what trust really means, having your back in ways that you need it.
And I think part of what you're saying, and correct me if I'm wrong here too, is there's an element of humility to it, cultural humility, that you see people as the experts of their experience. You take time to get to know them, but you also have to do homework yourself. You can't put it all on the other person. You have to do your homework, but then take time to really be with, to ask, to get to know, to be curious.
And I think that really speaks to my role in academia when I work with students who say they want to work with students in diverse communities. Or in any community, I always say you got to look at yourself first and figure out what you're bringing into that situation, because if you have these preconceived ideas of who those students are going to be, that's going to, first of all, kids can see that, they can feel that, and so that it's really important to really kind of take care of that so that you're not passing on any ideas that could limit those students' potential. Like if you're approaching that situation from an idea that you believe certain groups present certain ways, or that they're not able to achieve the same life goals as others from other communities, then that's going to inhibit learning, whether those folks recognize it or not. So for me, I feel like it's learning to be a teacher, learning to be a counselor, all requires a lot of self-reflection and growth and personal kind of looking at oneself, because that could then play out in whatever environment.
I have something to add to that I would agree with in terms of just being mindful and self-reflective. And we see this in the Student Success Center, where students may come in and say, I'm really going to struggle with this course, or I've struggled with this topic previously. And I know that I'm guilty of this myself. We'll say, well, you'll learn from your mistake, or it's okay to fail. And I've had students check those exact phrases and say, I really don't have room to fail. I'm a student that comes from a low income background, and failing means that I have to retake and pay for a course that I initially probably struggled to financially make ends meet, or that, I am a caretaker. And so taking a remedial course means that I'm going to be here for a semester longer, and I don't have that option. And I think it's almost, being mindful of the biases we have and the privileged phrases that we use and how they don't apply to all of our student populations.
With our values, don't place our own values on them. We don't know where they're coming from or who they are.
So let me see if I can capture a little bit of what's going on here. As I was kind of digging through the library and reading all this kind of academic jargon, which certainly I take part of that sometimes, I came across a bunch of different definitions of trust, if you will, and I tried to kind of put them together to figure out, what is this thing? Can we feel it? Can we see it? Is there something to it? A little bit more. And prepare yourself. I've got a little bit long definition, right? We'll see how it goes from there. And I just want you to think if this is capturing some of the ideas that we're sharing together here. Trust is an expectation or reliance on the integrity, honesty, reliability, and fairness of a person, group, institution, or system. And because that's not enough, I have more. It forms the foundation of healthy relationships and interactions, and there's more. Some of the main characteristics include reliability, integrity, consistency, transparency, competency, mutual respect, vulnerability, and credibility. And it can be influenced by communication, behavior, past experiences, and culture. So I thought we were just talking about trust here. But no wonder it's so complicated and difficult for many to build and maintain. So I know that was a lot, but I think it does capture a lot of what we were talking here. But how do you respond hearing this kind of definition from my digging around in the research?
The behavior
Mhm.
is what really stood out to me. And it's important that we do as we say, right? Our missions, our visions are all great. But if we can't hold ourselves, to our end of the bargain and our end of the deal, then we could potentially lose the students' trust. And so that really goes a long way, that I am putting, my money where my mouth is.
I actually have a question for Jim. So if a client comes in and asks for something, but it's not something that you can do, how do you maintain that trust with that person?
Do some research. I mean, I use toolbars like findhelp.org and NowPal, and that, and I could do research in that. For a discussion, maybe a friend of mine who works in a different agency will be able to help them. The point is, never say no, because people are, been told no for many times, right? So they come to you, and I think what everybody's been saying is the acceptance part and the being not judgmental. I think that's very important, because everybody goes through something. And as you were mentioning, be kind and compassionate, and sit down and have a conversation with them. You don't have to go into detail right away. Just sit down and you're a friend I never met. I always bring people up to my office, and it's a little wild in there at times, but but it's comfortable, and that's the whole trick, is to make people comfortable, right? You want some water? Sometimes they don't want to talk. I say, well, I want to go up to, we have a rooftop garden now, which is great. So sometimes I'll ask the person, hey, let's go for a walk. Oh, we have a rooftop garden. Come on. We'll go out there and sit down. If she wants to talk, maybe she'll talk. If not, she'll just walk around. And when she's ready to go, we'll go. But she'll call back. And that's the whole thing. You don't have to get all the information at once. You just try to help them. Or, you try to help them and give me a call back. I had a call Saturday night from a woman who was placed in a hotel, and she has 3 children. And she's taking the initiative. What are my next steps? What are my next steps? And I said, well, you have to go back to the Board of Social Services, see what programs you can get. Well, they denied me already. So she has a child that's 8, and I have a friend of mine that works for the Board of Education. So I gave him a text over the weekend, and he met with her this morning. And so this with the McKinney-Vento program. So this way the child's not going to be out of school. Then she came down to Oasis. I got her Pampers and her food bag. We have an appointment specialist. She's not in on Mondays, but I'm going to make an appointment for her to come in during the week to meet with them. The point is that there's always something that you can do just to alleviate the stress of the person, and then we take it step by step from there.
When they come into Oasis, they may not know exactly what they need. They're coming in, they need help. As Jim said, they need help. So by being your authentic self and being transparent and asking them a lot of questions, we can navigate through other things. Like Jim got the call for one thing, and then he offered her something else, and then the door opened to something else. So I think asking questions, being honest and be authentic and being real with them, and just talk on their level. We have women from 35 countries, and I always try to learn hello and a few other words in their language. And it may sound funny to them, and it's not always the right accent, but it breaks a barrier, breaks a wall. They'll laugh at me. I'll laugh at them. I'll laugh at myself. So I think that's all part of being trustworthy.
And one other piece that I'm hearing the folks at Oasis talk about is this idea that you're on the journey with people. And so it's not that you're leading them always, but sometimes you're standing side by side with them as you move from office to office or person to person or situation to situation. And I think that really enhances trust.
I think this captures some of the parts of what I had shared early in that overly long kind of definition that seemed to encompass everything. But, and Hanan, this goes back to you, what you were originally saying with the behavior part. And it makes me think of some of the most famous kind of communications research from Dr. John Gottman, if you've ever heard of him. And nonverbal behavior accounts for 80% of all communication. 80% by what you do, not what you say, right? And that's coming out here is what we do is so much more important. And then there has to be consistency between the verbal and the nonverbal. And if you don't have that, you have to believe the nonverbal. You have to believe the behavior, because that will be more likely telling you the kind of quote unquote truth. And that's going to make or break your trust, right? So I think that's a big piece of these two. It's really being authentic, being open, trying to do some things that show that you're being considerate, compassionate, learning hello in a language to make them feel a little bit more comfortable that you're putting in some effort to create that space and be there.
Could I just add one other
Please.
thing related to what you're saying? Again, this is about Oasis. Setting a space that feels welcoming, I think is really important. So like things that we don't always think about, but like having windows and having really colorful spaces for children and having a rooftop garden. I mean, who has access to roofs? Usually those who are wealthy, right? So this idea that you have spaces that are welcoming people and making them feel respected and valued and treasured.
I think that's a perfect segue as well to really kind of get into maybe some of the things that you do at Oasis specifically that have worked really well to help build trust. Other than you had, Jim, you had just said, don't say no, right? That's a really important piece. You try to figure it out and be with them, being authentic. What are some of the other things that you've learned in your experience that really help build and maintain trust?
After COVID, we noticed that the children needed more help academically. So they trusted us to put them in a Saturday program or an after-school program, which was fun, and they had a little bit educational component. But we asked them if they wanted more help, if they needed more academic help. They trusted us to say yes. We opened last year or the year after, a full academic program on Saturdays. So now they trust us to help them with their children's education. They have fun. I'm not saying they don't have fun, but it's Patterson teachers that come and teach their children as a support to their academic daily schedule. So I
think also what Oasis does really well, and having known them for as long as I have, is that they have the right people there too. So it's not just going through the motions kind of thing. It's like a sincere approach to the work, an authentic approach to the work. And that makes a big difference, because if it's a culture of trust. It's not just a trustworthy person, but this entire system that really is committed to the same goals. And that makes an enormous difference. Because if people feel that it's not just, oh, Mr. Walsh that we can talk to that is a good guy, but that everyone, including Mr. Walsh, is there for them, that changes people's perception. And as a result, they're an agency that's highly respected in the community, that people seek services from. And even if it's something that extends beyond what they can do, because, you know, the men's program works on the weekends, then it's, okay, come on the weekends, or let's figure this out. And I think if other people can see them as a model for how to make things work in terms of just that rapport building, that relationship building, it does go a long way. Because people do get burnt out, right? You know, like the helpers get burnt out. So it's figuring out how to continue to check in on them so that they can feel that, okay, the work is important, it matters. Let's figure out how to find a space so you can decompress and then to come back fresh, you know, again. So it's taking care of your people, but also so that those people can take care of others. And again, I think that Oasis does a phenomenal job with that.
How do you respond to that, Jim?
We, everybody there believes in a mission statement. I think that's the main core, understanding and belief in the mission statement. Because it's not about me, it's not about Evan, it's not about anybody else. It's about the people who we serve, who come in. We're fortunate that we serve breakfast and we serve lunch. there, and that's a good opportunity to sit down with our guests that come in and just talk to them. Because once they get to know you and feel comfortable with you, they're going to open up to you. There's a number of homeless women that come in the morning. I sit down with them, talk to them. Whenever and they need anything, they'll come and see me. Sometimes they'll say, I need a detox. Yeah, okay. When you want to go? Well, I can't go now because I got to take care of business. Okay, I understand that. Come back and see me when you can. It's all good. But as long as they know that I'm there for them, and anybody else, if I'm not there, is there for them, we'll be able to provide the service that's needed.
I think that's great. And certainly that's something when I was able to visit, we had lunch, we walked around, and it really is like, it's just taking those moments to just be with people, to listen, like to really listen and pay attention, to give empathy, right? It's those small details that can really matter, and being driven by the mission and being very clear.
You're providing dignity and respect. And that's a basic human need, right? Basic human need is food. We never say no to a food bag or anything. We're not supposed to serve men during the day. I'll see men early in the morning because I'm there early with Evelyn. We're there around 5:36. I'll see the man before 8 o'clock, not to break the sanctity of our mission statement. Otherwise, I'll see him on Saturday. Otherwise, maybe at lunchtime or something. But men need Pampers. Men need food bags. So it's always looking at what the need is in society, right? We started the GED in Spanish because there's a need. We started that 2 years ago, and now it's full, right? Capacity.
We have over 35 students in that program, and we have a waiting list of about 10 right now. So,
and we don't
it's a
advertise.
big need.
It's all by word of mouth. So, and if it's by word of mouth, it's saying that I trust this organization. I trust the people that serve it.
We forget that men are single parents too. And that's why we serve them on Saturdays or try to do GED in the evening.
So as we begin to kind of wrap this up, I think there's a lot of running themes that certainly fit with a lot of this. But I'm curious, what are your kind of takeaways from this short, but I think really depthy discussion? What do you take away? What is a good suggestion for other community organizations to follow that's doable? Doesn't cost a lot, because that certainly is an issue for most today, that can be most impactful on building and maintaining trust?
I think
Evelyn?
collaboration.
Collaboration.
No one organization could do everything, and that's the important part of collaboration. And I believe that nonprofits should work more together in order to get the resources for the community at which we serve.
Hanan?
I think it's also showing the person that you are, looking for them to be successful, not only when they're in your institution or only when they're in the Student Success Center or only when they step foot in Oasis, but also outside the confines of the center and the organization, and that knowing that their well-being out in the real world is just as important as when they step foot into your center or your space.
I agree with everything that you've all said, and it kind of speaks to the spirit of this whole podcast about collaborations, but also, leadership as well is important in terms of being able to provide that model for the team about, this is how we do business here. But it's not just a top down, but also from the bottom up, and recognizing, what strengths younger people may have that they could also bring and share, and ensuring that there's constant checking in with your team to make sure that, you're sticking to the spirit of your mission, but also that you're doing the work in the most authentic way possible that builds collaborations and trust.
And I think readiness, so the readiness of us as folks that are providing services or training people who are providing services, so culturally ready and, and having connections, et cetera, but also being patient enough, as Jim was saying earlier, being patient enough to be ready when our clients or our guests are ready to come to us, right? Because sometimes that moment's not the right moment when we are available. So then how do we make ourselves available?
So I think for me, maybe a couple of takeaways is everything that you all said, but it starts with some of our own work, right? We have to be authentic, but we have to put in some work to get to know other people, to take time, to be curious, to ask, to get to know, but also do a little homework there. And certainly we have to build collaborations with others in the community that we can connect people to if we can't provide something. So not saying no. And I think probably in a future episode, we should probably look at collaborations between community organizations, because sometimes there can probably, my guess is, be a little territorial, because you may be competing for similar grant funding. Maybe there's some overlap in services, and I'm sure there's many stories for that. So maybe we can look at that in the future. But I think trust really is, it's such a beginning point, but it's a point that never ends. You have to constantly maintain that trust every day, and it's so easily broken when we're inconsistent, when our words and behaviors don't match, right? So I want to thank the listeners for tuning in. I want to thank the guest audience that was here today, to thank all of my amazing colleagues and guests for joining us on this very first podcast. And follow us at the College for Community Health at Montclair State. If you'd like more information about Oasis, their services, their programs, you can go to www.oasisnj.org, oasisnj.org, to learn more about them and what they do. And I'd also mention that any of the ideas shared here represent our ideas and not necessarily those of the organizations we're part of. So I'd also like to give one special thanks to Elvis Guyan for some assistance preparing some materials. And thanks for joining us. Until next time.
Thank you.